Good morning, guys. Am I audible? Yes. Thank you, sir. Okay. So we'll start today's session. In today's session, the discussion is centered around the important questions asked in vasculature of head and neck over the previous years. Okay. So the blood supply to the head and neck, it's coming from the subclavian artery and vein. The branches from the common carotid artery. Yes. And they've asked about dural venous sinus. And a lot of questions have appeared around blood supply of thyroid gland and tonsil. So in this picture, can you identify the subclavian artery? This is brachiocephalic trunk on the right side. The brachiocephalic trunk on the right, that's going to divide into right common carotid artery and right subclavian artery. Okay, so you know it's from the right side, it's from the brachiocephalic trunk, and on the left side it's coming directly from arch of aorta. So till what extent you're going to call it as subclavian artery? Yes, from the sternoclavicular joint, level of the sternoclavicular joint to the outer border of the first rib. Okay, sternoclavicular joint to outer border of first rib, you'll call it as subclavian artery. What is going to happen after that? It continues as axillary artery to the upper limb. So the subclavian artery is going to supply the upper limb. Yes, and then the anterior abdominal wall. Also via the vertebral artery, it's going to supply the brain. Okay. Can you see this muscle dividing the subclavian artery here, this anterior to the subclavian artery? Can you tell me what muscle it is? What is the muscle that you see here? The very important image, guys. Whatever seen in this image, you should be able to identify. Very good, Dr. Vignesh. That's the scalenus anterior. And a nerve running anterior to it. The nerve running anterior to the scalenus anterior has been asked in your previous question. Can you identify this nerve? Yes, guys, come on. That's the, yes, the nerve running anterior to scalenus anterior is phrenic nerve. No, Sindhuja, that's the phrenic nerve. Okay, please remember it has been asked recently in your NEET-PG question. Okay, injury to that nerve, paralysis of the diaphragm on that side. Yeah, it also supplies the pleura. So the nerve that you see anterior to scalenus anterior is the phrenic nerve. Where is vagus nerve now in this diagram? Since you got confused, so this is your internal jugular vein. This is your common carotid, which will continue as your internal carotid artery. Can you see a nerve running in between? Yes, that's the vagus nerve, right? And one more nerve that you should definitely know that you got confused now, the recurrent laryngeal nerve. Where do you get to see recurrent laryngeal nerve? Yes, this is the trachea. Behind the trachea, this is the esophagus. In the tracheo-esophageal groove, this is the recurrent laryngeal nerve. Is that clear? So these three nerves have been repeatedly asked in your image-based question. Okay. Phrenic nerve, the best place that you see there is over the scalenus anterior. Vagus, you cannot make a mistake at all between the IJV and common carotid or internal carotid. And recurrent laryngeal nerve always in the tracheo-esophageal groove. Okay, guys. So coming back to subclavian artery. So that's a subclavian artery as you see here. Yes, coming from the brachiocephalic trunk on the right side, divided by the scalenus anterior into three parts. Okay. I'll show you the branches here itself. You have to identify it. Okay. Before that, the relations and whatever you see in this image. So can you tell me what is this structure that lies anterior to the subclavian artery? That's the subclavian vein, right? Behind the subclavian artery, what you see there? That will be the trunks of the brachial plexus. Now, you see the phrenic nerve here. Yes, you saw the vagus here. Can you see this loop here? Something winding around the inferior aspect of your first part of subclavian artery. That's the ansa subclavia. What is ansa subclavia? Ansa subclavia is nothing but the loop connecting the inferior and middle cervical ganglion, winding around the lower aspect of the first part of subclavian artery. So relations, you remember anteriorly the subclavian vein, posteriorly the brachial plexus, the cervical part of the sympathetic trunk, anterior of course the phrenic and the vagus and the ansa subclavia. And don't forget the subclavian artery itself is going to arch over the cervical pleura and the apex of the lung. Okay. Branches, I'm sure you all must be thorough. Okay, what else in this image? You can identify the trachea. We saw the nerves. This is the esophagus you saw. Yeah. The branches alone we haven't told. So the branch from the first part, what is first part of subclavian artery? From its origin there up to the medial border of scalenus anterior. Okay. The first part of the subclavian artery, I'll be telling in another few minutes, it forms the base for the scaleno-vertebral triangle there. What are the branches coming from the first part of the subclavian artery? Yes, vertebral artery. Can you find the vertebral artery here? Yeah, this one there. This is the vertebral artery. Okay, can you identify that there? That's the vertebral artery. Then the one that's not seen here, but the only branch that's going downward will be the internal thoracic artery. Easier to see here is the thyrocervical trunk. The thyrocervical trunk gives rise to 3 branches. Okay, what are they? The one that follows, this point is very important. Please be with me. The one that follows behind the clavicle, that's the Suprascapular Artery. You cannot mistake it at all. Okay, that's the only clue. It goes behind the clavicle. Okay, and then the second thing also easy to identify. The loop you see here, the artery that forms the loop here, that's the inferior thyroid artery. Okay, next picture, you have to identify the artery. And the next one, superficial cervical artery. From the second part, that's the part which lies behind the scalenus anterior, we get the costocervical trunk. From its name, can you identify what will be the branches? Yes, guys, they've asked the branches in your subclavian artery in previous questions, so you should know, definitely know the answer. Branches. Costocervical is going to divide into deep cervical and superior intercostal. The superior intercostal is going to give rise to the posterior intercostal arteries of the upper 2 intercostal spaces. Okay, and from the third part, you get the dorsal scapular artery. Sometimes what happens, this dorsal scapular artery and the superficial cervical artery, it arises as one common trunk that you'll call it as transverse cervical artery. So if you get to see this term transverse cervical artery, and if you don't get to see this term dorsal scapular artery, you should understand. Okay. So okay with the branches of subclavian artery. First part VIT from the thyrocervical trunk, remember SIS. Okay. Second part costocervical trunk. Third part dorsal scapular. In the next diagram, you're going to tell me the branches now. So you can see this is the sternum here. This is scapula. So you're seeing it from a side view. You can make out the subclavian artery here, right? Till the outer border of the first rib only, you call it as subclavian artery. Beyond that, it's the axillary artery. Can you tell me what is this branch here? Yes, 1. What is 1? Come on, waiting for your answer. The only branch that is going downwards is Dr. Swati. Very easy to identify. The only branch that is going from the inferior surface downward on either side of the sternum, internal thoracic artery, you'll never have a difficulty in identifying it. And then this one, number 2, You can see it passing through the foramen transverse area of the transverse process of your cervical vertebra. Very good. So that's the main clue. The only artery passing through the foramen transverse area of your cervical vertebra, C1 to C6. And then, yeah, this is your thyrocervical trunk. From the thyrocervical trunk, the easiest one is to identify is the loop. The artery with the loop course. What is that? Inferior thyroid artery. Yes. From the inferior thyroid artery, can you see an artery passing above but anterior to the vertebral artery? That's called, I'll label it as 5, okay? It is clinically important. The ascending cervical artery, okay? Just listen to my words. This ascending cervical artery, it lies medial to the phrenic nerve. So this is an important clue for the surgeon to identify the phrenic nerve. It's a landmark to identify the phrenic nerve because it lies medial to the phrenic nerve. Okay. And then coming here, the branches from the thyrocervical trunk. This one which follows behind the clavicle, I told you, what is it? Number 6. That's the Supra. See, there are 7 cervical vertebra, but the vertebral artery passes through the foramen transverse area of C6 to C1, not the 7th one. Okay, C1 to C6. We'll be talking about it. And this one, number 6, I told you, I gave a clue. It follows close to the clavicle, behind the clavicle, the Suprascapular Artery. Right? 7th one, what is left? We have seen the inferior thyroid, suprascapular. This one, can you see here? Coming up in the posterior triangle and then going along the medial border of the scapula, transverse cervical artery. Transverse cervical artery, medial border of scapula. We'll be talking about it. This one here, can you see the costocervical trunk? Okay, I'll erase few numbers. Okay. This one here, this is the costocervical trunk. Costocervical trunk. As the name suggests, it's going to divide into the one coming below to the intercostal spaces. I told you, this is the superior intercostal artery. What does it do? It provides the posterior intercostal artery for the upper 2 spaces. The posterior intercostal artery for the other spaces comes from the descending thoracic aorta. What is happening to the cervical branch? This is the deep cervical, okay? The deep cervical artery. So you see the vertebral artery, just anterior to it, you can see the ascending cervical. That's a branch of inferior thyroid. Posterior to it, you see the deep cervical coming from costocervical trunk. Okay, guys, with this image. Okay. Yeah, we was asking about, sorry, for 3 to 7, posterior intercostal arteries. That's what you're asking, right? Posterior. The posterior intercostal arteries, anterior intercostal arteries, I'll be showing you now. There are 11 intercostal spaces. Of the 11 intercostal spaces, first 2 are coming from superior intercostal artery. All the others are coming from descending thoracic artery, descending thoracic aorta. That's why, remember, in coarctation of aorta, I didn't put a picture, sorry. In coarctation of aorta, what do you see in the X-ray? Notching of ribs. This notching of ribs will not be present in the upper 2 spaces because these come from the superior intercostal arteries and not from the descending thoracic aorta. Okay, guys, please remember that. So vertebral artery, yes, coming from subclavian artery. Okay. Yeah, first part of subclavian artery. Thanks, Vignesh. So this is going to be divided into cervical part, vertebral part, the first part, second part, the third part is the suboccipital triangle, and the fourth one is intracranial. So you can see the vertebral artery here. This one. Okay. So this is scapulovertebral triangle. The first part of the vertebral artery, soon of its origin, it lies in the scapulovertebral triangle. Easy. So this is the scalenus anterior. This is the longest coli. The base is formed by the first part of subclavian artery. So what are the things? And the apex will be formed by transverse process of C7. So what are the things that you see here? You'll see the first part of vertebral artery. Just anterior to it, you can see the loop of inferior thyroid artery. You'll get to see the sympathetic trunk, right? Can you see the sympathetic trunk? The middle cervical ganglia, the inferior cervical ganglia, the cervical part of sympathetic trunk. Okay, these are the contents of this triangle. Yes. Second part. Second part is the one that you see here. As I told you, there are 7 cervical vertebra. But the 7th cervical vertebra usually will not have a foramen transversarium. Okay. And the second part, keep in your mind, they've asked it again, from the foramen transversarium of C6 till C1. C1, 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 C6 to C1, right? Excuse me. And the third part is this one. So this is your C1, this is C2, C3, C4, C5, C6. Okay. So the third part is in the region of suboccipital triangle. Okay. And the fourth part, it will pierce the dura. Yeah. And it will reach the cranial cavity. What's happening? It combines with the vertebral artery of the other side to form the basilar artery, right? So what is subclavian steal syndrome? When there's an obstruction to the subclavian artery, proximal to the vertebral artery, what happens? There is no blood supply to the upper limb, right? Subclavian artery is going to continue as axillary artery. So there's no blood flow to the upper limb. So what can happen? The blood from the brain can be diverted via the vertebral artery of the opposite side, via the basilar artery to the upper limb of this side. This is called subclavian steal syndrome. Okay. Vertebral artery branches, if you see, first part, yeah, like you'll have muscular branches. Second part, mainly spinal branches. In the suboccipital triangle, of course, yes, I told you, the relation, it forms these structures, the brachial plexus, subclavian artery, subclavian vein, they all related to the thoracic inlet. Yeah. Obstruction, any tumor of that Pancoast tumor can obstruct these structures. The third part, muscular branches. The fourth part of the vertebral artery gives the important branches. What are they? The anterior spinal artery, the posterior spinal artery. Yes, it supplies the medulla, it supplies the meninges, and important branch. What is this? Pica. Posterior inferior cerebellar artery, right? So what are the syndromes related to the vertebral artery? So what is this picture? Medulla, cross section of the medulla. You can identify the pyramid here. What is this nerve emerging out of the medulla on either side of the midline? 12th nerve. Okay. So this region, yes, you see the inferior cerebellar peduncle. Yeah. Here, an important nucleus is there. Nucleus ambiguous. Okay, nucleus ambiguous. Yes, it's going to give rise to the fibers which supply the muscles of palate, pharynx, larynx. Okay. Special visceral efferent column. This is the spinal nucleus and the tract of the trigeminal nerve. You can see the spinothalamic tract also will be the lateral spinothalamic tract. These will be the vestibular nuclei. The vestibular nucleus is this one. Okay. So the inferior cerebellar peduncle, the vestibular nuclei, the nucleus tractus solitarius, dorsal nucleus of vagus, nucleus ambiguous. Okay. So what are the two syndromes related? The lateral medullary syndrome, also called Wallenberg syndrome, right? The medial medullary syndrome. Okay, it's called the Dejering's anterior bulbar syndrome. So what is the artery involved in this case? The pica, the posterior inferior cerebellar artery, okay, which supplies the posterolateral zone of the medulla, when occluded can give rise to the lateral medullary syndrome. And this, the anterior spinal artery branches, yeah, that supplies the paramedian zone of the medulla, okay. So what are the structures involved here in the medial medullary syndrome? Medial meniscus, pyramid, hypoglossal nerve, MPH, master in public health, okay. So what will happen when there is the injury to the medial meniscus? Medial meniscus is nothing but the crossed fibers of your dorsal column pathway, right? So contralateral, laws of vibration, proprioception, all the posterior column sensations carry. P is your pyramid. Pyramid is also not crossed, right? So contralateral hemiplegia. Yeah. And that hypoglossal nerve, ipsilateral deviation of tongue. Okay. Now, how to remember lateral medullary syndrome? Which one is more vast? The medial. The structures involved in the lateral medullary syndrome are more vast than the medial medullary syndrome. Okay. Vestibular nuclei, nucleus ambiguous, spinothalamic tract, spinal nucleus and the tract of the trigeminal nerve. Okay. The cerebellar peduncle. So this is the mnemonic I've kept. Vast C, or the C is vast. So, okay. Vestibular nuclei. Involvement of that will get, yes, giddiness. Yeah. Ambiguous, I told you. The special visceral efferent column, ipsilateral paralysis of the muscles of palate, pharynx, larynx. Okay. The lateral spinothalamic tract. Yes, that's a crossed one. Contralateral loss of pain and temperature from the trunks and limb. The spinal nucleus and tract of the trigeminal nerve. It is ipsilateral, loss of pain and temperature from the face. Okay, so remember, spinothalamic tract and spinal nucleus and tract of germinal nerve, it's both pain and temperature, but trigeminal nerve is confined only to the face, right? So involvement of spinal nucleus and tract of trigeminal nerve, loss of pain and temperature sensation from the ipsilateral face. Okay. Lateral spinothalamic tract, pain and temperature, but it's a crossed one. So contralateral, loss of pain and temperature from the trunk and limbs. Cerebellar peduncle, ipsilateral ataxia. Is that okay? So in relation to vertebral artery, remember the subclavian scale syndrome, Wallenberg syndrome, and the medial medullary syndrome. Okay. Internal thoracic artery, you will never have a difficulty to identify that. You can see the phrenic nerve crossing it from lateral to medial side. Remember this relation. As I told you, some of you have the doubt, right? How many intercostal spaces are there? Totally 11. Okay. Anteriorly, the 11th and the 12th rib will be floating. They will never come in the front. So there'll be only 9 intercostal spaces. Only the upper 9 intercostal spaces will be supplied by the anterior intercostal arteries, of which the upper 6 will receive branches from the internal thoracic artery. So this is the internal thoracic artery. At the level of 6th intercostal space, it's going to terminate into superficial epigastric and musculophrenic artery. So till the 6th, each space will have 2 anterior intercostal arteries. Okay. Up to the 6th intercostal space, there are branches, direct branches from the internal thoracic. 7th, 8th, and 9th is coming from musculophrenic artery. Okay. 10th and 11th, the anterior intercostal space is open in front. There are no anterior intercostal arteries, but posterior intercostal arteries are present in all the 11 spaces. Okay. And the first two are from superior intercostal artery, and the rest of them are coming from the descending thoracic aorta. Okay, this was asked in your NEET-PG question. Tell me the answer. In subclavian artery block, at the outer border of the first rib, all the following arteries help in maintaining collateral circulation except. Yes, waiting for your answer, guys. So remember the scapula we saw? The scapular anaesthemosis, yes, is between the branches of first part of subclavian artery and the third part of axillary artery. Okay, maybe we'll discuss it and then come back to this question. Okay, so this is your axillary artery. This is subclavian artery. This is scapula. So this is the superior border of the scapula. You see the glenoid cavity, this the acromion process here. So this will be the lateral border of scapula. This is the medial border of the scapula. Okay. Now the artery related to the upper border of the scapula is suprascapular artery. Okay. The artery running along the medial border of the scapula is transverse cervical artery. Okay. This artery running along the lateral border is from the axillary artery. This is the largest branch of the axillary artery, the subscapular artery. This subscapular artery will give rise to the circumflex scapular artery. Okay, these are from the third part of axillary artery. So in and around the scapula, there is anastomosis between, suprascapular, transverse cervical are all coming from the thyrocervical trunk. That's the first part of subclavian artery. Okay, and these are branches from the third part of axillary artery. So the scapular anastomosis is between the subclavian artery and the axillary artery. The first part of subclavian artery, the third part of axillary artery. Okay. So whenever there's an obstruction, there's flow in the reverse direction here. So all that you have to find out here is which is the odd one out. Suprascapular artery from the first part of subclavian artery. Thyrocervical trunk, yes, from the first part of subclavian artery. And subscapular artery from the third part of axillary artery. Okay. Superior thoracic artery is a branch coming from first part of axillary artery that is not involved in scapular anastomosis. Okay. So the axillary artery, remember what is the muscle dividing the axillary artery into three parts? Pex minor, pectoralis minor. The first part, very good Vignesh. From the first part, you have only one branch, superior thoracic artery. Right? From the second part, you'll have the lateral thoracic artery and the thoracoacromial artery. Okay. From the third part, three branches. What are they? Already you know, subscapular artery, the anterior circumflex humeral artery, the posterior circumflex humeral artery that's going to wind around the surgical neck of humerus. Is that okay, guys? They've asked in your NEET-PG question, this one. Yeah, coming to the next one, the common carotid artery, easy. So on the right, you can see the common carotid here. On the right side, it's going to come from the brachiocephalic trunk. On the left side, arch of aorta. Yes, they have asked once, what is the level of termination of common carotid artery? Yeah, it corresponds to upper border of lamina of thyroid cartilage. Yes, vertebral level C3 to C4. Where do you find carotid sinus? Where do you find carotid body? Carotid sinus at the bifurcation of the common carotid, and the proximal part of internal carotid artery, which is a baroreceptor. Where do you find carotid body? In the posterior wall of carotid sinus, and that's a chemoreceptor. Okay. External carotid, very important. Yes. So what are the branches from external carotid? Yeah. You know the mnemonic. Can you tell me the branches from the external carotid artery? You should be able to identify it in this diagram also, picture also. Ascending pharyngeal artery. Yes. Superior thyroid artery. Above the superior thyroid artery will be lingual artery. Above the lingual artery, facial artery. Opposite the facial artery will be occipital artery. Okay, please make a note of it. These are the 5 branches that you get to see in the carotid triangle. Okay, carotid triangle, these are the 5 branches you'll get to see. And then above that, you'll see the posterior auricular artery. And the terminal branches, what are they? Superficial temporal and maxillary artery. A lot of questions have been centered around external carotid artery and its branches. There's a mnemonic, right? All of you must be remembering. Sister Louise' powdered face often attracts medical students. Okay. Mnemonic to remember the branches of external carotid, and I'm sure all of you know that. Let's identify the branches here. So where is ascending pharyngeal artery? Number 1. You saw the external carotid. This one here is the ascending pharyngeal artery. Only one point interesting about it. Anyone knows? That's the only medial branch coming from external carotid artery. Okay, it's small, but it has a long course. It goes all the way to supply the pharynx, palate, and it also provides meningeal branch, tympanic branches. Okay. Then this one, the next important one, which we'll be talking in bit detail, going downwards, that's the superior thyroid artery. There was a question asked in the previous year recently. The superior thyroid artery is the first branch of external carotid artery. Is that clear? Please make a note of it. The superior thyroid artery is the first branch of external carotid artery. Okay. You can see a branch coming from the superior thyroid artery piercing the thyrohyoid membrane. This is your hyoid bone. This is the thyroid cartilage. That's the superior laryngeal vessels. Okay. Yes. We'll be talking in detail about it coming. This is the lingual artery. Yeah, only one thing you should know very much about the lingual artery. What is the muscle dividing it into 3 parts? Anyone? The lingual artery is divided by which muscle into 3 parts? We saw recently, right, in musculature of head and neck. Yes, guys. Waiting for your answer. Marandu pochu ellathukku adukulla hyoglossus. Okay. I thought you might remember. Okay, there's a picture I put. Hyoglossus. Please. Okay, remember hyoglossus divides the lingual artery into 3 parts. Ipo sonningala axillary artery, pectoralis minor. Subclavian artery, scalenus anterior. Lingual artery, hyoglossus. Okay. Yeah, anything else? I think these are the ones. Okay, please don't forget. Then what are the other thing? Yeah, opposite. This is your hyoid bone. This is the greater corner of the hyoid bone. Opposite the tip of the greater corner of the hyoid bone, that's the lingual artery. And above that, this is the facial artery. Okay, you can see the facial artery grooving the posterior part of submandibular and then winding around the mandible to enter the face. So it has a course in the neck where it gives some important branches. Okay, this one here, that's the occipital artery. Sorry, here, this is the ascending pharyngeal. This is the occipital artery. This is posterior auricular artery. This one going up. The division, the termination of the external carotid takes place within the parotid gland. Okay, This is the maxillary artery. Mnemonic for external carotid artery. I thought you guys know, not it. I'll tell you. So this is the superficial temporal artery. You want a mnemonic to remember the branches. Sister, like while I was doing first MBBS, this was a mnemonic we were taught. Sister Louise, powdered face. I'm sorry. Wait. I'll write the mnemonic first, then you can get the branches. You want me to use a separate color? Yeah. Okay. I'll write the mnemonic in the separate color. Sister Louise, powdered face often attracts medical students. Okay, no logic in the mnemonics now. Okay, what is S? S is superior thyroid artery. L, lingual artery. Abhishek, are you there? This mnemonic, I'm reminding it for you. Yeah. Yeah, I have a mnemonic, Vignesh, I'm coming there. P is posterior auricular artery. F, facial artery. O is occipital artery. Abhishek, take it down. A is ascending pharyngeal artery. M, maxillary artery. Superficial temporal artery. இப்ப நான் டிஸ்கஸ் பண்ணும்போது எல்லா ஆர்டரிக்கும் ஒரு பாயிண்ட் தான் சொன்னேன். அசெண்டிங் பெரிஞ்சியல் ஆர்டரிக்கு நான் உங்களை ஞாபகம் வச்சுக்க சொன்னது இட்ஸ் தி ஒன்லி மீடியல் பிரான்ச், ரைட்? Superior thyroid artery, I told you that's the first branch. Lingual artery பத்தி பேசும்போது என்ன சொன்னேன்? Divided by hyoglossus into 3 parts. Facial artery நான் சொன்ன ஒரே பாயிண்ட் ஃபேஸ் மட்டும் தான் ஞாபகம் இருக்கும். But remember, it has a cervical course also. That's going to give rise to few important branches. Okay, இப்போதைக்கு அதை ஞாபகம் வச்சுக்கோங்க. Fifth one, I told you it's the occipital artery. Sixth one, posterior auricular artery. Seventh one, the superficial temporal. Eighth is maxillary artery. S. Vignesh, I have a mnemonic for maxillary artery coming. எனக்கும் ஞாபகம் வச்சுக்க mnemonic தேவையா இருந்துச்சு. Okay, so no, need not worry. Okay, here superior thyroid artery மட்டும் நம்ம டீடைல்டா பார்க்கணும் because lot of questions have been centered around that and I think you might know about it. Ascending pharyngeal, no. Yes, Prakalya, okay, please remember it has been asked recently in your 2020 or 2029 or therila. Recently it has been asked and it has been given in Gray's Anatomy textbook, okay? That's why I'm repeating it again and again. Superior thyroid artery is the first branch confirmed in the Gray's Anatomy. Okay, yeah, recently asked. Superior thyroid artery பத்தி பார்த்துடுவோம். So superior thyroid artery, it arises below the எல்லா branchesக்கும் வந்து landmark வந்து the tip of the greater corner of the hyoid bone தான். Superior thyroid artery வந்து arises below the tip of the greater corner of the hyoid bone. It will give a infrahyoid branch. It will give the superior laryngeal vessel that pierces the thyroid membrane along with internal laryngeal nerve. Okay, it goes down. It gives the glandular branches. It also gives branches to supply the cricothyroid. Musculature of head and neck supply. பேசும்போது ஒரு முக்கியமான muscle or blood supply பத்தி பார்த்தோம், ஞாபகம் இருக்கா? Sternocleidomastoid. The upper 1/3 of the sternocleidomastoid receive branches from occipital artery. Middle 1/3 from superior thyroid artery, and the lower 1/3 is from your suprascapular artery. Okay, please remember. So superior thyroid artery, occipital artery are going to supply the sternocleidomastoid, which is a commonly used muscle flap. Okay. Superior thyroid artery. Nerve accompanying it. What is the nerve accompanying the superior thyroid artery? Yeah. You see the superior thyroid artery? On the posteromedial aspect, ENT, external laryngeal nerve. On the posteromedial aspect, okay? Posteromedial aspect. What does external laryngeal nerve do? Supplies the cricothyroid muscle. What is the action of cricothyroid muscle? Tensor of the vocal cord. So to prevent injury to the nerve, it's usually tied close to the gland because they travel close. Gland பக்கத்துல வரும்போது பிரிஞ்சிடுவாங்க. Okay, this is all old concept, I think. Okay, so it's ligated close to the gland. The questions centered around blood supply of thyroid gland from your previous papers. Make an attempt to identify, then we'll discuss. Okay, the middle thyroid vein drains into. Yes, what is the answer? B. Yeah, so how many thyroid veins are there? Superior thyroid vein, middle thyroid vein, inferior thyroid vein, and one more vein of Kohila that comes from the lower pole. Okay, so superior, middle, and vein of Kohila, all of them will drain into internal jugular vein. What is exceptional is inferior thyroid vein that will drain into the brachiocephalic vein. If you see a picture, you'll remember very well. Usually the left brachiocephalic vein. Okay. Yes, this one. Recurrent laryngeal nerve is in close relation to which of the following artery? Recurrent laryngeal nerve. Ipadana paathom, superior thyroid artery accompanied by external laryngeal nerve. Okay, so it can't be superior thyroid artery. There's no middle thyroid artery. Okay, inferior thyroid artery, that's a branch coming from the subclavian artery, right? The loop of the inferior thyroid artery we saw. Which of the following is not true? Superior thyroid artery, branch of this is all your previous questions only, guys. It's not the ones that I framed. I took it from the books. Okay, superior thyroid artery, external carotid, inferior thyrocervical, thyroidea artery. So there's a superior thyroid artery, inferior thyroid artery, and thyroidea artery that comes from directly arch of aorta. The parathyroid gland is supplied by, yes, that was also a question. Yes, the parathyroid glands, please remember, it has been asked frequently. The blood supply to the parathyroid gland is mainly from the inferior thyroid artery or the anastomosis between the superior thyroid and inferior thyroid artery. This one, in emergency tracheostomy, all the following structures are damaged except easy. Come on, logically thinking. This is isthmus that lies in the midline, right? Arteria thyroidea on the arch of aorta and the Vardadu midline lericum. Okay, inferior thyroid veins also they come to lie in the midline. The inferior thyroid artery you'll get to see in the sides. Okay, so the midline structures only will be involved. Okay, and I think this is the last one. Yeah, in relation to thyroid. During thyroid surgery, nerve goes along the superior thyroid artery is injured. What can be the possible consequences? Just now we saw, right? External laryngeal nerve supplying the cricothyroid. So this is the picture I want you all to understand for the previous questions. You can see the superior thyroid artery. You can see the external laryngeal nerve. Yes. Superior thyroid artery injured. The nerve accompanying it will be external laryngeal nerve that supplies the cricothyroid muscle. So emergency tracheostomy is a midline procedure. So yeah, all the midline structures will be damaged, including the isthmus, arteria thyroidea coming from the arch of the aorta that also lies in the midline. The inferior thyroid veins also they lie in the midline. Inferior thyroid artery, they are paired, okay? Yeah. Paramedian position. Recurrent laryngeal nerve is going to supply your, the adductors will be paralyzed. You cannot like abduct the cord. It will be lying in the paramedian position. Okay. So superior thyroid artery, all of you saw. External laryngeal nerve, you can make it out. Yes, welcome Harish. So now the one that you should see is your inferior thyroid artery. Inferior thyroid artery and the nerve that's going to accompanying it. Okay, remember this is the tracheo-esophageal groove. Recurrent laryngeal nerve. Yes. And okay, you can see the arch of the aorta. So arteria thyroidea varadharana, it comes from the arch of the aorta. It enters through the lower pole, inferior part of the isthmus. Veins identify. This is the superior thyroid vein. Okay, you can see the middle thyroid vein. Where is the inferior thyroid veins? Can you see? Inferior thyroid veins are located here. These are the inferior thyroid vein. What is the fourth vein? I told you, vein of Kocher. If at all it comes from the lower pole of both the lobes. Okay, vein of Kocher. So the superior thyroid and middle thyroid, you can see it opening into the, this is your IJV. You can see it opening into the IJV. What is happening to the inferior thyroid veins? Going towards the brachiocephalic. Okay. Now this is to show you the parathyroid glands, the superior and inferior on the posterior surface. Okay. So the superior, this will be the superior thyroid artery, inferior thyroid artery. They usually anastomose in the posterior border. The blood supply to the parathyroid is mainly from inferior thyroid artery. That's a branch from first part of subclavian artery. Okay. Lingual artery, only one thing I want to stress it again. What can you see this muscle here? Yeah, the name of the muscle, this muscle that's cut is hyoglossus. Why is it cut? Edukaha cut panirkanga? To show you the second part of lingual artery. Please remember the lingual artery divided into 3 parts by this hyoglossus. This is the first part of the lingual artery. Okay. Second, hyoglossus a cut panada, second part theriyum. And along its anterior border, this will be the third part. Yes. Facial artery, all that I ask you to remember it goes in the neck and in the face. Neck la face la branches you can tell. Inferior labial, superior labial, lateral nasal, angular, all that. Neck la branches are very important. Inferior tonsillar. Okay. Ascending palatine. Branches to supply the submandibular gland and submental branch. Is that fine? Okay. These are the branches of facial artery given off in the neck region before it enters the face. Yes. Okay. This was also asked in your previous year question paper. So just see this thing. There is a swelling on the right side of the scalp. Okay. A pulsatile swelling. Okay. In the right temporal occipital region. Dilated veins were noted. Any idea what is the diagnosis here? Did you go through your previous year question papers? There was a term, right? Cirrhoid aneurysm. Very good. Yeah. Cirrhoid aneurysm. Okay. So this is about that. So it is an arteriovenous malformation. And the main ones involved will be the, you can see the superficial temporal and the occipital also contributing to it. Okay. Superficial temporal as well as the occipital. Okay. Mainly superficial temporal. The second choice will be occipital artery. Okay. Yeah. People kept asking me mnemonic for maxillary artery. So all that you remember for maxillary artery, it is a terminal branch given off within the parotid gland. Largest terminal branch. It is also going to be divided by a muscle into 3 parts. What is the name of the muscle dividing into 3 parts? Very good. Please, so in 3 things we have, 4 things we have seen, right? Axillary artery divided into 3 parts by axillary artery divided into 3 parts by pectoralis minor. Subclavian artery divided into 3 parts by scalenus anterior. Innonu paatholadam. Lingual artery. Lingual artery divided into 3 parts by hyoglossus. Okay. And the last one, maxillary artery divided into 3 parts by lateral pterygoid. Okay. Marakakudadu. Please keep it in your mind, okay? Now coming to maxillary artery, I told you largest terminal branch within the parotid gland divided into three parts by lateral pterygoid. The first part from the neck of the mandible till it reaches the lateral pterygoid. The second part, it lies either superficial or deep to the lower head of lateral pterygoid. And the third part, you can see it passing between the two heads of the lateral pterygoid. Okay. Through the pterygomaxillary fissure, it enters the pterygopalatine fossa. Branches from first part, deep auricular, yes, anterior tympanic, middle meningeal, accessory meningeal, inferior alveolar. Okay, someone is asking me, ma'am, mnemonic for, yeah, this is how I remembered. Jamai solrala, adhu mari damai. Okay. Second part is easy. Second part, what are the muscles of mastication? Temporalis, temporal branches, medial pterygoid, lateral pterygoid, pterygoid branches, masseter, masseteric. Okay, buccinator is not a muscle of mastication, but you have the buccal branches. Is that okay for second part? Okay. Third part, the mnemonic is, I forgot to put a picture. Heard about this? Peppa Pig's Kelly. Okay, if you have kids at home, you might be knowing. Yeah, what are the names? Peppa Pig's, the mnemonic here is Posterior alveolar. Okay. A is artery of Vignesh, are you there? Artery of pterygoid canal. Yeah, try to answer. What is PIGS? P will be one more. Pharyngeal artery. Okay. I is the continuation of the maxillary artery. Infraorbital artery. Yes, is the artery of episcasis. What is that? Spinopalatine artery. Maxillary artery branches keta inma correcta solidlama. Vignesh, is it okay? Okay. Okay, for the first part, deep auricular, anterior tympanic, middle meningeal, accessory meningeal, inferior alveolar. Like clinically important is middle meningeal. We'll be discussing it now. Okay. The second part branches are from the corresponding to the muscles of mastication. Temporal, masseter, pterygoid, include the buccinator also. Okay, buccal. And the third part, postero-superior alveolar, artery of pterygoid canal, pharyngeal. The one that you have to remember here is infraorbital artery, continuation of maxillary artery. Artery of episcasis will be spinopalatine artery, right? Okay, from the diagram that you should identify, maxillary artery kandupidichuveenga. Okay, you can identify the lateral pterygoid muscle also. Yeah, this one is the middle meningeal artery. How does it enter the middle cranial fossa? Passing through which foramen? Middle meningeal artery passes through foramen spinosum. Very good, Vignesh. Okay, foramen spinosum. Okay, and then this one also you can easily identify entering the mandible. So it is inferior alveolar. Okay, inferior alveolar going to supply the lower jaw. This is the branches to the medial pterygoid. This will be branches to the temporal. This one here, this is important. This is the postero-superior alveolar. Either kandipa solliye aganu. This is the infraorbital. So these are the things you can identify in this picture. Okay. in the posterior alveolar, right? It will give rise to the, this is posterior superior alveolar. The infraorbital artery will give rise to the middle superior alveolar and the anterior superior alveolar. Okay. So the infraorbital not only supplies the orbit, yeah, it also supplies the upper jaw by giving anterosuperior alveolar and middle superior alveolar. Picture ulta was that. Okay, you can see the impressions in the bone here. Can you tell me what is it due to? Those are the impressions on the skull produced by the middle meningeal artery. Okay. And what is this point? You must have heard about it. The pterion, where the four bones meet. The sphenoid, the greater wing of sphenoid. The frontal, the parietal, and the temporal. The trunk of the middle meningeal artery lies deep to the pterion. Okay. And rupture of that will cause extradural hemorrhage. How does the accessory meningeal artery enter the cranial cavity? Through accessory meningeal artery enters through the foramen ovale. The male structures, mandibular nerve, accessory meningeal artery, lesser petrosal nerve, emissary vein. Is that okay? Okay, now this is the artery of episcasis. Can you see here? This is your sphenopalatine artery. In the sphenopalatine artery, how does it terminate? It's interesting. This is the greater palatine artery. Remember, greater palatine artery coming also from the third part, PIGS. Yeah, sphenopalatine, greater palatine, infraorbital, pharyngeal artery. So the greater palatine artery goes beneath the hard palate. You can see here incisive foramen and anastomosis with the sphenopalatine artery. It traverses in the groove of the omer. Yes, they've asked this. Can you tell me? Common carotid artery divides at the level of vertebral level C3 to C4. Blood supply to facial nerve. They asked this once from the ascending pharyngeal artery, middle meningeal artery, from occipital artery. Okay, it was a multiple choice question. Multiple answers were there. Yes, the only medial branch of external carotid artery is right. Branches of external carotid seen in carotid triangle. Abhishek, are you there? You remember the mnemonic? What are the 5 branches you get to see in the carotid triangle, Abhishek? Ascending, pharyngeal, superior thyroid, above that lingual, above that facial, opposite to that occipital artery. Right? Which of the following is not a branch of external carotid but taking part in Kieselbach's plexus? Yes, this is also from your previous NEET-PG question. Very good, very good, very good. It's coming from the ophthalmic artery. Yeah, so Kieselbach's plexus in the septum of the nose, nasal septum, antero-inferior part. Arteries contributing to it will be anterior ethmoidal, posterior ethmoidal, sphenopalatine, and from facial artery. Okay, of which the anterior and posterior ethmoidal, they come from the ophthalmic artery. Palatine tonsil, again, lot of questions I told you centered around the palatine tonsil. The blood supply, you can see the palatine tonsil here. I'll take a blue color must be visible. It has an anterior tonsillar branch. It has a superior tonsillar branch. It has an inferior tonsillar branch. It has posterior tonsillar branch. Okay. The anterior tonsillar branch comes from the lingual artery. You can see the tongue there. So the artery that supplies the tongue, it comes there. Anteriorly by lingual artery. Posteriorly, you'll have the ascending pharyngeal and ascending palatine branch of facial artery. So from that, posteriorly will be ascending pharyngeal and ascending palatine. That's a branch from facial artery. Superior. Any guesses? What is this? Where's the superior coming from? So this is your palate. Remember, we see the greater palatine artery coming and going like this to anastomose with the sphenopalatine artery. So superior will be branches from the greater palatine artery. Inferior, the important one coming from the facial artery. The inferior tonsillar branch, that's the main supply to the palatine tonsil coming from the facial artery. Okay. And the venous drainage also has been asked frequently. Excessive hemorrhage in tonsillectomy result from injury to? Yes, your previous question. The external palatine vein, which is also called the paratonsillar vein, right, in the tonsillar bed. Okay. Internal carotid artery, nothing much here actually. So it comes from the carotid, it lies within the carotid sheath. You can see the internal carotid here. So this also has the cervical part, then passes to the petrous part of the temporal bone here. Then it lies in the cavernous sinus. Yes, it lies in the cavernous sinus, and then it pierces the roof of the cavernous sinus to form the cerebral part. Okay, the branches, there are no branches in the cervical part. Petrous part, it gives rise to the carotico-tympanic branches. Cavernous part, the main branches, inferior hypophyseal artery. The pituitary gland receives its blood supply from the carotid, okay, from the cerebral part, okay. The branches from the cerebral part are important. Remember, what are they? Superior hypophyseal artery, ophthalmic artery, okay, and then anterior cerebral artery, middle cerebral artery, and then it has the anterior choroidal artery, 6 branches, guys, posterior communicating. Okay, these are the branches from internal carotid arising from its cerebral part. Okay, is that fine? So here you see the cavernous sinus there. This is your internal carotid artery. Can you identify what is this nerve that lies infralateral to it in the floor? That's the, very good, that's the abducent nerve. Can you identify these nerves here? The oculomotor nerve, the 4th nerve. This is the ophthalmic division of the trigeminal nerve. Okay, the maxillary division, okay, that has been removed from the textbooks. It's not a content in the lateral wall. What is the actual content of cavernous sinus? Is nothing but the venous blood. So all that you see here, it lies outside the endothelium of the cavernous sinus. Okay. So the blood supply to pituitary is mainly from the, it's from the internal carotid. Yeah, ophthalmic artery, since they asked, you should know, it enters the optic canal, it enters the orbit through the optic canal, lying infralateral to the optic nerve. You can see the ophthalmic artery there. This is the lacrimal artery coming from the ophthalmic artery. Okay, these are the posterior ciliary arteries. Can you see one artery piercing the optic nerve? That's the central artery of retina, which is an end artery. Okay, this will be the supraorbital artery. The branches on the medial side are important. Okay, this is the region of your ethmoidal sinus. This is the posterior ethmoidal artery. This is anterior ethmoidal artery. This will be medial palpebral branches. This is dorsal nasal branches. This is your supratrochlear branch. Okay, why are we talking about this? The dorsal nasal branch, it anastomoses with angular artery on the face. This lacrimal artery will anastomose with few branches from medial meningeal artery. So these are the sites of anastomosis between branches of internal carotid artery and external carotid artery. Okay, dorsal nasal branch and the lacrimal branch of ophthalmic artery. External jugular vein and internal jugular vein, you should definitely identify. A main includes the sternocleidomastoid muscle. Superficially to the sternocleidomastoid muscle, what you see here will be the external jugular vein. Sternocleidomastoid muscle எடுத்தாதான் அதுக்கு கீழே டீப்பா இருக்கிற internal jugular vein தெரியும். Okay, please remember that. So how is the external jugular vein formed? The posterior auricular vein unites with the posterior division of retromandibular vein. The superficial temporal vein, maxillary vein unite to form the retromandibular vein that will divide into a posterior division, anterior division. In the posterior division, will combine with the posterior auricular vein to form the external jugular vein. What is happening to the external jugular vein? Related to the posterior triangle roof. Where does it end? It reaches the supraclavicular triangle. It pierces the deep fascia 2.5 centimeter above the clavicle and enters into subclavian vein. Okay. Okay. இது யாருன்னு சொல்ல முடியுமா? Yeah. Okay. So this is the mnemonic for the tributaries of external jugular vein. Okay. So what are the first to last one? The formative tributaries. Posterior auricular vein, posterior division of retromandibular vein. Okay. Then in the posterior triangle, you'll have the transverse cervical vein, suprascapular vein, anterior jugular vein, occipital vein. Sorry, this is the oblique. Occipital usually enters into internal jugular. Okay. Posterior auricular vein. Oblique jugular vein connects the external and internal jugular. And then the posterior external jugular vein. I was telling my husband yesterday, பிள்ளைங்களுக்கு பேர் choose பண்றதை விட இந்த mnemonic choose பண்ணது is a bit difficult. Yes. Hope you remember it. Pop star. And this is what my children call it as K-pop. BTS band army. You people must be familiar with it. I'm not. Okay. So remember the tributaries of external jugular vein are these. Okay. Can I move on? Jif workout agada therlada. Yes, this was in the like the movie in Ratchagan, right? Nagarjuna, you can see the entire course of external jugular vein, the venous drainage of your upper limb and your head and neck. Cheri, idhula external jugular vein paakalama. Yes, external jugular vein, can you see here? Yeah. Before that, appreciate the sternocleidomastoid. Is it trapezius? In the posterior triangle, you can see the external jugular vein. So normally, it's not engorged, except in the right heart failure. SVC obstruction due to a mediastinal tumor can cause engorgement of the external jugular vein. Internal jugular vein, I told you, it lies beneath your sternocleidomastoid within the carotid sheath. So what is it? Where is it coming from? Internal jugular vein. External jugular vein, enga irundhu paathom. Internal jugular vein, where is it coming from? It's a continuation of sigmoid sinus. Right, you can see it in the neck. It comes to the posterior compartment of in a jugular foramen. You can see it in the neck. How does it terminate? It joins with the subclavian vein to form the brachiocephalic vein. Tributaries, easy. Mnemonic alla illa. The arteries, the veins corresponding to the branches of external carotid artery. Enala pharyngeal vein, superior thyroid vein, middle thyroid vein, lingual vein, common facial vein, occipital vein. Okay, all these branches, the veins accompanying the branches of external carotid will open into the internal jugular vein. The very first tributary should remember inferior petrosal sinus. And the last tributary, the right lymphatic duct, and on the right side and on the left, the thoracic duct. Is that fine? So again here, you can see the external jugular vein. The line, they have shown you the course of the internal jugular vein once the sternum, beneath the sternocleidomastoid. Okay, so please orient to this. And the two important nodes you should remember in relation to internal jugular vein, this one here, in relation just below the posterior belly of the digastric, that's the jugulodigastric lymph node. And in relation to the intermediate tendon, inferior belly of omohyoid, jugular omohyoid, intermediate tendon. So this is the principal lymph node for the tonsil. Omohyoid are the principal lymph node for the tongue. Okay, in malignancy of those. Dangerous. Why is it called dangerous area of face? This area, the upper lip, the adjoining nose, the medial angle of the eye. Any infection in this area, even acne, they tell no acne or any cut during shaving, any infection in that area can track on to the cavernous sinus thrombosis. What is the root? Root. So that area, there are two ways of communication into the cavernous sinus. One is via the deep facial vein, which communicates with the pterygoid venous plexus. The pterygoid venous plexus will communicate with cavernous sinus. Then here you remember the facial vein is formed by the union of supratrochlear and supraorbital vein. They form the angular vein. These in turn will have communication with the superior ophthalmic vein. The superior ophthalmic vein is in turn a tributary of cavernous sinus. So any infection in this part of the face can easily track on into the cavernous sinus via these two routes. Okay, moreover, facial vein, there are no valves and it rests on the muscles. Okay, so the movement of these muscles can easily spread the infection. Yes, all are paradural venous sinuses except this is also your previous NEET-PG question. Easy. Easy, guys. Customer. The great cerebral vein of Galen drains into dural venous sinus. Only few areas are important, right? Yes, very good. Yeah, I have explanation is coming up. Okay. Internal cerebral veins, they are in the region of diencephalon. Okay, they unite to form the great cerebral vein of Galen. Yes, that will join, it will open into the straight sinus, inferior sagittal. It join with the inferior sagittal sinus to form the straight sinus. Okay, what are the, okay, this one, which of the following is not a tributary of cavernous sinus? I don't know whether you might know this one. Okay. This one easy. Fox cerebri contains. Looks like you people. Okay, have to revise dural venous sinus. So what is dural venous sinus? The veins inside the cranial cavity. Why are they called sinuses? Because normal vein tunica adventitia, media, and then the intima. But in the dural venous sinus, there's only going to be endothelium, intima, matana irukapodhu. It can dilate. Okay. So that's why they're called dural venous sinus. Where are they located? Within the dura. Dura, two layers, right? Endosteal layer, which is going to stick onto the skull, the meningeal layer, which is going to form the folds. So most of the dural venous sinus, as you see here, it lies between the endosteal layer and meningeal layer. Except two things, okay? The inferior sagittal sinus that you see here and the straight sinus. Please make a note of it. The inferior sagittal sinus and the straight sinus, they lie between the meningeal layer itself, between the meningeal fold itself. So identify the dural folds first. What is this dural fold? Cerebral hemisphere. Between the right and the left cerebral hemisphere, you have the fox cerebri. What are the dural venous sinus related to the fox cerebri? The one that you see above will be superior sagittal sinus, right? The one here on the inferior border will be inferior sagittal sinus. This dural fold that you see here will be fox cerebelli. Between the cerebrum and the cerebellum, between the two cerebellar hemispheres, and that will have the occipital sinus. Okay, guys, another 10 more minutes, we'll wind up the lecture session. Occipital sinus. Then you have something called the tentorium cerebelli, where the falx cerebri and the falx cerebelli meet. That will lodge the straight sinus. Okay. So the one that has been asked frequently is your paired and unpaired dural venous sinus. So the unpaired dural venous sinus, we have a mnemonic here. The midline ones, okay? The superior sagittal sinus, superior sagittal sinus, the inferior sagittal sinus, and the straight sinus, they all lie in relation to your falx cerebri, okay? The straight sinus. Okay, and then this is your occipital sinus, that is also in the midline. Then this over here, the basilar part, you have the basilar venous plexus. That is also in the midline. Now you remember the cavernous sinus on both the sides of the body of the sphenoid. These are connected by anteriorly and posteriorly by anterior intercavernous sinus, posterior intercavernous sinus. Okay, guys, this is all that you have to remember, the paired and unpaired. Unpaired are the ones in the midline. Please remember this mnemonic, SBI SOAP, okay, for the midline dural venous sinus. The paired ones that you see here, can you identify this? This is the transverse sinus. This is sigmoid sinus. This is sigmoid sinus. And here, this one here, this is your superior petrosal sinus. Over the petrous part of the temporal bone above will be superior petrosal. This small one here, that will be the inferior petrosal sinus. Cavernous sinus, you'll not have a difficulty in identification. Cavernous sinus. Over here, above the superior orbital fissure, this will be the sphenoparietal sinus. You can make out the anterior and posterior intercavernous sinus. This is the one I talked about, the basilar venous plexus. Okay, another thing, can you tell me what is this? Can you see a blood vessel here beneath the dura? These are your middle meningeal veins. Very good, very good, very good, Vignesh. Okay. So have I left anything? Nothing, no? There's one more one. Additionally, when petrosquamous sinus can be present. Okay, transverse sigmoid sinus, any infection of the ear, yeah, mastoid, that can cause thrombosis of the sigmoid sinus. Okay. This I tried with clay some 2 years back. Okay, here the same thing here. This is your occipital sinus. The transverse sinus. Okay, you can identify the sigmoid sinus here. Yes, the superior and the inferior petrosal sinus. Okay, and this is the middle meningeal one veins that you told. Sphenoparietal. I've tried to show you the on petrosquamous also. This is the cavernous. Okay. So cavernous sinus on either side of the body of the sphenoid. Yes. The only thing that you should know is tributaries and relations. Tributaries, remember, okay, there's few questions on that. Cavernous sinus thrombosis, the paralysis of the 3rd, 4th, and 6th cranial nerve, along with the ophthalmic division of the 5th nerve, localizes the lesion to cavernous sinus. We just now saw the relations, right? Within the cavernous sinus and the lateral wall, 3rd, 4th, and the ophthalmic division in the flow 6th one. Okay, another thing that can happen, sometimes any trauma, fracture of the base of the skull, what can happen? Communication between the arterial blood of internal carotid artery and the venous blood within the cavernous sinus, leading to pulsating, yeah, exophthalmos, edema of your lids. Yes. This is what? Cavernous sinus receives input from all the rest will be, yeah, it receives from the superior ophthalmic vein, from the superficial middle cerebral vein. These are all the communications, okay? So, yeah. This question was asked, blood supply to inner ear is from your labyrinthine artery, that's from basilar artery, or it can directly come from the anterior inferior cerebellar artery. Okay, guys, I just want to talk about the tributaries of cavernous sinus. One picture. Okay, here I can show you. Just the last slide, okay? Stay with me. Tributaries mainly from the orbit. So what are the veins related to orbit? The superior ophthalmic vein, sometimes the inferior ophthalmic vein, and sometimes the central vein of retina. Okay, and from the brain, the cerebral veins, the superficial middle cerebral vein, inferior cerebral veins, and the anterior division of middle meningeal vein, and the sphenoparietal sinus. These are the tributaries of cavernous sinus. Communication is, yeah, it communicates with the transverse sinus via the superior petrosal sinus. It communicates with internal jugular vein via the inferior petrosal sinus. It communicates via the facial vein via the pterygoid venous plexus. Okay, so route of infection, you'll be knowing. Just the one-liners, do it with me. The artery that acts as a guide for locating phrenic nerve, do you remember? The artery that lies medial to the phrenic nerve. Surgical landmark, I told you. The ascending cervical artery, that's a branch from inferior thyroid artery. Yes. The first branch of external carotid artery, someone asked me, Prakalya, yes. Please remember, it's the superior thyroid artery confirmed in your grades of anatomy. Smallest branch of external carotid artery and the only medial branch, ascending pharyngeal artery. The muscle dividing lingual artery into three parts, hyoglossus. The principal artery of tonsil, inferior tonsillar artery, that's a branch from facial artery. Artery involved in extradural hemorrhage, middle meningeal artery coming from first part of maxillary artery. That's coming from external carotid artery. Artery of episcasis, sphenopalatine artery. Branch of ophthalmic artery, that's a typical end artery. Central artery of retina. The blood supply to orbital muscle is from ophthalmic artery. Okay, which will give rise to the anterior ciliary arteries. Nothing. The posterior ciliary arteries are direct branches of ophthalmic artery, whereas the anterior ciliary arteries come from the muscular branches. Okay, guys? Yes, we'll wind up today's session. Any doubt, get back to me. Thank you. Have a great day.